Welcome to the demonstration of the Advanced Abdominal Palpation and Delivery Mechanism Integrated Simulator. This comprehensive system includes a maternal pelvis, articulated fetal models, a mechanical birthing simulator, and a cervical dilation examination set. This comprehensive training system provides all the essential components for hands-on obstetric and maternal fetal education. Let's begin by preparing the simulator for a manual delivery demonstration. The articulated fetal model, complete with a realistic placenta and umbilical cord, is carefully positioned within the clear, simulated womb of the pelvic matrix. Once the fetus is secured, the mechanical crank handle is attached to the rear of the simulator. This allows the instructor to precisely control the speed and progression of the simulated birth. By rotating the handle, educators can manually guide the fetus through the birth canal. This provides students with a clear, realistic visualization of the delivery mechanism, from crowning to the final delivery of the placenta. Next, we configure the system for abdominal examinations. The fetus is placed directly on the pelvic base, followed by the lifter soft pad and the lifelike abdominal cover. Using the included hand pump, the soft pad is inflated to simulate the amniotic sac, creating an optimal, realistic surface for practicing Leopold's maneuvers. The simulator also features a comprehensive set of interchangeable cervical modules. These realistic inserts accurately represent the various stages of cervical effacement and dilation, from a closed cervix up to 10 centimeters. These modules integrate seamlessly into the birthing simulator, allowing trainees to perform realistic vaginal examinations to assess labor progress, determine fetal head position, and build essential clinical confidence.